Welcome again to our channel, Halal Medical. Sexual health is a vital component of our overall well-being, and for many, medications known as sexual stimulants have been revolutionary. They've helped millions of men worldwide manage conditions like erectile dysfunction, restoring intimacy and confidence. However, with the power of these medications comes a critical responsibility to understand them fully. Today, we're taking a deep dive into the potential side effects of sexual stimulants. Our goal is not to scare you, but to empower you with knowledge so you can make safe and informed decisions about your health. Before we explore the side effects, it's essential to understand how these drugs work. Most common oral sexual stimulants like sildenafil or tadalafil belong to a class of drugs called PDE5 inhibitors. They work by relaxing the smooth muscles and increasing blood flow to specific areas of the body, most notably the penis. This mechanism is key to their effectiveness, but it's also the root cause of nearly all their potential side effects, as this vasodilation isn't just localized. Sexual stimulants can have both short-term and long-term side effects, especially when used incorrectly, in the wrong dosage, or without crucial medical supervision. Let's break down the main risks, starting with the most common ones. Many users experience what are considered mild to moderate side effects. The most frequent is a headache. This happens because the drug's blood vessel widening effect also occurs in your head, increasing pressure and causing pain. Similarly, you might experience facial flushing, where your face, neck, or chest becomes red and feels warm. This is a direct result of increased blood flow to the skin. Indigestion or an upset stomach can also occur. The same muscle-relaxing effect that helps with an erection can also relax the sphincter between your stomach and esophagus, potentially leading to acid reflux. Finally, nasal congestion is common, as the blood vessels in your nasal passages swell, making you feel stuffed up, similar to having a cold. While often temporary, these effects can be quite bothersome. Moving to more serious concerns, we have cardiovascular problems. Because these drugs lower blood pressure, they can be dangerous for people with certain heart conditions. For individuals with a history of heart attack, stroke, arrhythmia, coronary artery disease, or uncontrolled high or low blood pressure, taking a sexual stimulant can be risky. It can cause a sudden, significant drop in blood pressure, leading to dizziness, fainting, or in severe cases, a heart attack or stroke. They can also sometimes cause an accelerated or irregular heart rate. Let's consider a hypothetical case. A 55-year-old man with pre-existing heart disease who decides to try a friend's pill without consulting his doctor. The medication could drop his blood pressure to a dangerously low level, compromising blood flow to his already strained heart muscle, triggering a medical emergency. This is why a thorough cardiovascular evaluation by a doctor is non-negotiable. This leads us to another critical risk: dangerous drug interactions. These stimulants must never be taken with nitrate medications, which are often prescribed for chest pain or angina. Drugs like nitroglycerin also work by dilating blood vessels. When combined with a sexual stimulant, the synergistic effect can cause a catastrophic drop in blood pressure, leading to shock and potentially death. This is an absolute contraindication. Interactions can also occur with alpha blockers, used for high blood pressure or prostate issues, which can also lead to symptomatic low blood pressure. Furthermore, certain antifungal medications and antibiotics can interfere with the enzymes in your liver that break down the stimulant, causing drug levels in your blood to rise to dangerous heights, increasing the risk of all side effects. It is absolutely vital to inform your doctor of every single medication and supplement you take. Next, let's discuss potential vision and hearing damage. In rare cases, users have experienced a sudden loss of vision in one or both eyes. This is linked to a condition called non-arteritic anterior ischemic optic neuropathy, or NAIN, where blood flow to the optic nerve is blocked. While the risk is very low, the consequence is devastating and can be permanent. More common but less severe visual side effects include a temporary bluish tinge to your vision, light sensitivity, or blurred vision. Similarly, rare instances of sudden hearing loss have been reported. The connection is still being studied, but it is a recognized potential risk that requires immediate medical attention if it occurs. Another serious side effect is prolonged erections, a condition known as priapism. An erection that won't go away might sound like a joke, but it is a true medical emergency. If an erection is painful and lasts for more than 4 hours, you must seek immediate medical treatment. During priapism, blood becomes trapped in the penis and is unable to get oxygen. This can begin to damage and destroy the delicate tissues, potentially leading to permanent scarring and the inability to ever have an erection again. Do not wait. If it's been 4 hours, go to the emergency room. Beyond the physical, we must also consider the psychological impact. Over time, some men may develop a psychological dependence, feeling they cannot perform sexually without the pill. This can increase performance anxiety and create a difficult cycle to break, where the medication becomes a crutch rather than a tool. A significant and growing danger comes from counterfeit medications sold by unregulated online pharmacies. These fake pills are incredibly dangerous. They may contain the wrong dose, no active ingredient at all, or worse, toxic substances like paint, printer ink, or other harmful chemicals. Buying from unverified sources is playing Russian roulette with your health. Only get these medications from a licensed pharmacy with a valid prescription from your doctor. So how can you use these medications safely? The golden rule is to only use them under the guidance of a qualified medical professional. Your doctor will conduct a thorough evaluation of your medical history, especially your cardiovascular health. Be prepared to discuss all your health conditions, every medication and supplement you take, and your lifestyle habits, including alcohol and recreational drug use. Your doctor will determine if you are a good candidate, which medication is right for you, and will start you on the lowest effective dose to minimize risks. Finally, it's important to remember that medication isn't the only solution and is often most effective when combined with positive lifestyle changes. Regular exercise, maintaining a healthy weight, eating a balanced diet, quitting smoking, reducing alcohol intake, and managing stress can all have a profound positive impact on erectile function and overall health. Sometimes, these changes can reduce or even eliminate the need for medication. We hope this detailed overview has been helpful. Knowledge is the first step toward making safe choices. Do you have any questions? Don't hesitate to drop a comment about your concern. If you found this video useful and believe it could help others, please like and share it with your friends. Your support helps us create more content to keep you informed and healthy.